I'm going to go back. Sometimes when I look at this photo behind me, I'm not quite sure how I feel about it. I do like it because it's the only photo I have of my wife and I working together. And even though this photo was taken about 13 years ago, somewhere in Afghanistan, I can clearly see the concerned and worried look that my wife has in her face as she watches me place a cannula in this patient's arm is the exact same concerned and worried look that I see on her face these days as she watches me attempt to load the dishwasher in our house on the Gold Coast. Yeah, the married guys get it. But I also don't like this photo because it reminds me of a particularly challenging case, one in which I had to make a decision very quickly. And that decision, even though it took me less than 4 seconds to make, has stayed with me in the past, or for the past 13 years. And that's a story I'm going to share with you today. In 2009, I was working as a flight paramedic in Afghanistan. My primary role was the medevac of non-military contractors out of this region. Due to the nature of our work, we worked closely with the various Western military forces, and one day they asked a favor of us. A young Afghani soldier had been badly burnt fighting against the Taliban in one of the provinces, and while his treatment had begun in a military hospital in that province, it was decided it should now continue in a local Afghani hospital in the capital. The favor they asked of us was a simple one. Could we assist with the road transport of this patient from the airport in Kabul to a hospital in the city? So our local staff got on the phones, and before long, they informed us that they'd spoken to the best burns hospital in Kabul, and the good news was that this hospital was willing to accept the patient. A few hours later, myself and one of our very experienced ICU nurses set off in our unmarked ambulance with our security team to meet the military medevac plane that was about to land at the Kabul airport. When we arrived at the airport and made our way to the aircraft and the aircraft doors opened, we were met with a seriously unwell patient. This young Afghani soldier had significant burns to more than 50% of his body. He was floridly septic, and I remember these thick secretions coming up his trachea that required frequent suctioning. His eyes seemed wide with fear, probably due to the sense of hypoxia and suffocation he was experiencing, but possibly due to the fact that voices speaking languages he wouldn't have understood were carrying him in and out of aircraft, and I doubt he knew where he was going. Once he was in the back of our ambulance, the ICU nurse and myself set about desperately trying to improve both his respiratory and hemodynamic status for the 30-minute journey to this burns hospital. When we eventually arrived at the burns hospital, we were surprised to find a large crowd had gathered outside. Some were angrily chanting at us, and others were recording us with video cameras. Justifiably, us and our security team were made rather nervous about all this. We made our way inside the hospital, and we were shown the area or ward where this patient would be received. As soon as I stepped inside this ward, I realized that not much medical care was going to happen here, and this young man was going to die here in the next few hours, if not minutes. The few patients that languished in this room, that hardly had any linen in their beds, had IV bags hanging above their arms that had long run empty. And I can still see in the corner of the room one large rusty oxygen cylinder from which hung a dirty, grimy face mask that looked like it had seen many faces and been there for many weeks. That was the only identifiable piece of medical equipment in this room. Some local staff gathered around us, and none of them spoke in English, so it was impossible to effect a handover. The patient was placed on their bed, and then we experienced what can only be described as a torturous therapeutic vacuum, where he began to choke, and his respiratory distress worsened and worsened and worsened as we were unable to clear the secretions in his trachea, as no suction unit was in the unit, and our suction was still in the ambulance. I remember at this critical point, the head of our security team walked into the ward and made a signal it was time to go. We assumed the crowd was getting more restless and our lives were at stake. I looked at the nurse, and she looked at me, And over the next few seconds, I think she may have nodded as I withdrew the syringes of sedation and analgesia that I had in my pocket. I administered one final bolus to this patient and we left. Back in the safety of our ambulance with our security team in front and behind us in their Land Cruisers, we sped off back to the safety of our compound. The nurse and I saying nothing to each other, just staring at our respective windows, our bodies pushed against bulletproof vests that were pushed against the thin metal skin of the ambulance. It was only until we neared the compound and the roads became more familiar did she finally turn to me and say, "You did the right thing." I remember not replying to her because then, as now, I'm not sure I did. I've come to realize in preparation for this talk, mainly after speaking to some colleagues, that there were two choices I could make that day. There was an easy choice. That was to give enough medication that we wouldn't see him suffer as we left. And a hard or brave choice, which would be to give enough medication so he wouldn't be suffering at all. And I think I've known over these years that on that day, I wasn't brave enough. I don't know that young Afghani's name. I truthfully don't think I ever knew it, but I have seen him in the past 13 years since meeting him that day. And I've seen his marked respiratory distress in the respiratory distress of the 93-year-old great-grandfather who now has ROSC after receiving 15 minutes of CPR in the dementia ward of his nursing home. Those hands providing that CPR that fractured his sternum and his ribs knew they weren't helping, but felt compelled to do so because no advanced healthcare directive existed for this patient, and then they weren't empowered to make better choices. And I've heard that young Afghani's fluid-filled lungs, in the fluid-filled lungs of the 60-year-old mother who's dying at home of terminal cancer. Her daughters, unable to no longer endure her agonal breathing at moans at 3 a.m., have called the emergency medical services out of desperation. And their mother's wish to die at home with them now hangs in the balance. And I've smelt that young Afghani's burnt skin in the burnt skin of the young university student who's committed suicide by setting himself on fire in his car, the internal pain from his mental deterioration finally manifesting itself externally. And I remember pausing just before I RSI'd him, pushed the medications, and hoped I was about to be brave enough to ask him if he had anything he'd like me to tell his parents, because I knew they would be his last words. A great-grandfather, a mother, and a son. These and many others, my reminders of that young Afghani soldier. But also a reminder that death is not the enemy. We all die, our mortality is 100%. All in this auditorium know that more than most. And that doesn't mean I want the patients who I care for to die. It actually means the opposite. It means I care how they truly live right to the very end, and that when death is inevitable, the way of dying matters. A few years ago, my daughter introduced me to the world of Harry Potter, and reading her to bed one night, I came across a quote where a wise Professor Dumbledore is talking to a young Harry. Harry is concerned that he doesn't belong to the schoolhouse known for its bravery. Dumbledore explains to him that it is our choices that define who we truly are, far more than our abilities. Perhaps it was then I only realized that if I choose to provide care in line with good medical practice to these patients, rather than always trying to fight death, then I don't think I'm going to feel like I'm losing anymore, because then the patient, their family, and me, well, we win every time. Thank you very much.